Dementia Researcher with a blog and a rating.
Halving the social care reform budget and what it means for dementia. Recently, the government announced that the originally planned £500 million social care reform budget would be halved. That's only £250 million to be invested into a continuously underfunded social care sector. Now, £250 million is a lot of money, but not if we consider all the people who require care and support, including those providing unpaid care and those working in the sector. But what does social care mean? If we look at dementia, it includes paid home care, daycare, peer support groups, respite care, residential long-term care and other support. In addition, it includes carers allowance, as well as supporting and training a good quality social care workforce, working in those different community and long-term care settings. Why does social care matter? Physical health care often seems to get prioritized over social care, but both go hand in hand. Social care enables people living with dementia to get supported and cared for in their own home or in the community, to live as independent and well as possible. At some point, this also includes residential long-term care. Without adequate access to care, people with dementia can deteriorate faster, place greater caring demands on a family carer, if they have one, which can then lead to poor or poorer mental health and well-being for the carer. But it also means that people with dementia are more likely to enter residential long-term care faster. Without adequate access to care, people with dementia may reach a crisis point, which could have been avoided, and may have to seek healthcare, so GP or hospital. On the other side of social care, without an adequately funded care system, the paid and unpaid workforce cannot deliver the quality and quantity of care that is required for the growing dementia population. Many carers have long felt underappreciated, undervalued, and inadequately supported. The pandemic did nothing to help this, but rather has shown a stark spotlight on how carers are not supported and recognized and paid enough, and how to deal with pandemic restrictions and changing care needs without any guidance, unlike in the Netherlands. On top of that, we're currently living through a cost of living crisis, which makes working in the care sector even more unaffordable than previously, with news stories of carers quitting to work as lorry drivers or for supermarkets instead. So what does the halved social care budget mean? Staff and unpaid carers will continue to receive a lack of support and training compared to the standard that they require. People living with dementia will continue to face many barriers in accessing care, and many will not be able to receive the care that they require, or at least not in time. Obviously, the amount of money is not the only thing that matters, but also how it is invested to generate the most improvements to care and work for most. Social care seems to be the forgotten sibling of healthcare, but it is just as important. What can we do to overcome this bleak reform? Well, we've got some great European neighbours just across the water, where dementia care, workforce support, training and recognition, as well as the general system seem to work much better than over here. So why not try and learn from others and implement what works best?
Thank you for listening. Join the Dementia Research bloggers and share your own views.